health crisis that caused a political standoff as fears mounted that the country's democracy would come under threat. Well, eventually, the COVID-19 pandemic did not stop the municipal elections from going ahead. The Constitutional Court ruled that voting had to take place by November the 1st. But now that the polls have closed, the big question is whether gatherings at voting stations did in fact act as super spreader events. Well, to unpack observations on voting day, we're now joined by Angelique Coetzee of the South African Medical Association. Angelique, good morning to you. It's always a pleasure to speak to you. Roughly 10 million counted votes. I was actually, it was during the third wave, and I actually thought that the elections shouldn't have taken place on the 1st of November. Thinking about it now, it looks as if people kept their masks on, that there was social distancing. Are you expecting to see an influx of COVID-19 cases in the next 2 weeks?
Morning, Annika. Yeah, it's a difficult question. We will only know 2 weeks from Monday what's going to happen. Yesterday, we had our lowest positivity rate of 0.8%. That's the lowest figure for the year. So from here on, we will be able to see whether this had any impact on the numbers going forward. We also know currently how many people are in ICU and on ventilators, and that number is also very low. So if there's an increase in patients on ventilators and ICU, then we know that the severity form of COVID-19 most probably has been spreading through, some of these people wanting to vote. Also, not a lot of people vote in the deep rural town or township areas. It's more in the suburbs, and where there was also a better adherence to the non-pharmaceutical measurements. But again, you only need 1 or 2 people to spread the virus, especially to those that are not vaccinated or not fully vaccinated as yet. But again, time will tell us. This was the correct time. So SAMA also was in favor of having the elections now, because we saw that the numbers were going down. The problem again with postponing this to next year, I think they wanted to do it in January or end of January, beginning of February, I'm not sure. But that is a difficult time because, again, we might be going into a 4th wave during that time. So now was the best time, but whether this will hasten a 4th wave, only time will tell us.
Angelique, were there any concerns raised about COVID protocols not being observed at stations that came to SAMA?
Yeah, there was 1 or 2 doctors that were complaining, but again, it's difficult. That if you have long queues, it is better to split the queues than have one long queue. But again, we don't really have any power over that. And that is up to the IEC to make sure that this doesn't happen. Again, lessons learned. Unfortunately, only in a few years from now on, we will have another election. And maybe the lessons learned now will be forgotten by that time. But it is difficult. People. I say it's difficult, but it's actually common sense. You have to use your common sense and see this is a long queue, split the queue, make it easier for not to transmit any diseases, or to get the queues moving more quicker, so that people can go out and go back to their home or wherever they came from.
All right, thank you so much. That's Dr. Angelique Coetzee of the South African Medical Association.